Hello. We talk today about whether there was a solution reached by the scientists, and about the extent of their expectation of the situation in the future, and the development of this epidemic or a decrease in its capacity and spread. We hope to support the clip with admiration and subscribe to our channel to get all new. The WHO revealed the biggest single-day increment in instances of COVID-19 this week, with WHO Director General Tedros Adhanom Ghebreyesus, PhD, MSc, underlining that nations have far to go in this pandemic, at a press instructions. As states all through the nation and urban areas around the globe start to revive, despite the continuous increments in COVID-19 cases and passings, many have started thinking about what the finish of the pandemic might resemble. Irresistible Disease News approached irresistible illnesses specialists for their feelings on this inquiry, including the distance away the end might be, what patterns individuals can hope to show the end, and what, assuming any, rules are set up to demonstrate when it is suitable to end contamination control strategies. I envision the pandemic enduring an additional 2 years or until such a period that group invulnerability is accomplished by characteristic disease or mass immunization. That course of events is dependent upon introduction presenting defensive invulnerability, which, in view of restricted information to this point, appears to be conceivable. The finish of the pandemic in the United States will be late among countries of practically identical monetary standing, except if we create and mass-produce a defensive immunization first and don't share it extensively with the remainder of the world. There's a decent possibility the coronavirus will never leave. Significantly, after an immunization is found and sent, the coronavirus will probably stay for quite a long time to come, circling among the total populace. Specialists call such illnesses endemic, determinedly opposing endeavors to get rid of them. Think measles, HIV, chickenpox. It is an overwhelming suggestion, a coronavirus-tinged world without a predictable end. In any case, specialists in the study of disease transmission, fiasco arranging and antibody improvement state grasping that the truth is significant to the following period of America's pandemic reaction. The drawn-out nature of COVID-19, they state, should fill in as an invitation to battle for the general population, a guide for the trillions of dollars Congress is spending, and a fixed navigational point for the country's current, clamorous state-by-state interwoven technique. With so much else dubious, the ingenuity of the novel infection is one of only a handful, barely any things we can depend on about what's to come. That doesn't mean the circumstance will consistently be as desperate. There are as of now 4 endemic coronaviruses that course consistently, causing the regular virus. Furthermore, numerous specialists figure this infection will turn into the 5th, its belongings becoming milder as insusceptibility spreads and our bodies adjust to it after some time. For the present, however, a great many people have not been tainted and stay defenseless. What's more, the exceptionally transmissible infection has flooded as of late, even in nations that at first prevailing with regards to smothering it. Taken off alone, specialists state, it will essentially continue consuming the total populace. Pursue our coronavirus updates pamphlet to follow the flare-up. All accounts connected in the bulletin are allowed to get to. This infection is setting down deep roots, said Sarah Kobe, a disease transmission expert and developmental scholar at the University of Chicago. The inquiry is, how would we live with it securely? Battling endemic sicknesses requires long-run thinking, supported exertion and universal coordination. Getting rid of the infection could take decades, on the off chance that it occurs by any stretch of the imagination. Such endeavors require significant investment, cash and, the majority of all, political will. Americans have just begun to fold their heads over the thought, surveys appear. U.S. pioneers and occupants continue scanning for an enchantment shot to carry the pandemic to an unexpected end. Drugs that show even a trace of progress in the Petri dish have started deficiencies. The White House keeps on recommending summer's warmth will cover the infection or that it will bafflingly evaporate. An antibody, while pivotal to our reaction, isn't probably going to annihilate the malady, specialists state. Difficulties to inoculation are now getting clear, including restricted gracefully, against immunization resistance and noteworthy strategic barriers. In the interim, a few states are hurrying fast into reviving their economies. Indeed, even those moving all the more mindfully haven't created apparatuses to quantify what's working and what isn't, an essential component for any drawn-out logical trial. It resembles we have a lack of ability to concentrate consistently clutter at this moment. All that we're doing is only an automatic reaction to the present moment, said Tom Frieden, previous chief of the Centers for Disease Control and Prevention. Individuals continue asking me, what's the one thing we need to do? The one thing we need to do is to comprehend that there isn't a certain something. We need a far-reaching fight technique, fastidiously actualized. Individuals likewise continue discussing coming back to typical, said Natalie Dean, a malady biostatistician at the University of Florida. Be that as it may, a future with a suffering coronavirus implies that typical does not exist anymore. As we find various approaches to adjust and find what works, that is the manner by which we're going to begin recovering pieces of our general public and life, she said. A pressing break. America presently ends up in a snapshot of progress. Diseases are declining in certain states, even as they ascend in others with troubling developing hotspots. What's absent during this break, specialists state, is a need to keep moving. Showing up during this snapshot of change required countrywide shutdowns, taking off joblessness and destroying hits to our economy and psychological well-being. All that exertion should get us an opportunity to think, design and get ready, said Erwin Redliner, executive of Columbia University's National Center for Disaster Preparedness. Concerning that, I don't perceive any signs the government has taken in any exercises and is doing anything any other way to get ready for the following waves, he said. In short, the end game will probably include a blend of endeavors that halted notable flare-ups, social control measures, prescriptions and an antibody. We know how the COVID-19 pandemic started. Bats close to Wuhan, China, hold a blend of coronavirus strains, and at some point the previous fall one of the strains, sufficiently shrewd to cross species lines, left its host or has and wound up in an individual. At that point it was unhindered. What nobody knows yet is the manner by which the pandemic will end. This coronavirus is remarkable in the blend of its simple transmissibility, a scope of side effects going from none at all to fatal, and the degree that it has disturbed the world. An exceptionally vulnerable populace prompted close to exponential development in cases. This is an unmistakable and exceptionally new circumstance, says disease transmission expert and transformative researcher Sarah Kobe of the University of Chicago. Be that as it may, past pandemics do offer traces of things to come. While there is nobody verifiable guide to follow, humankind has experienced a few huge plagues in the previous 100 or so years that in the long run quit attacking society. The manners in which they stopped offer direction to a world searching for approaches to re-establish well-being and some feeling of regularity. 3 of those encounters, Kobe and different specialists state, propose that what occurs next relies upon both the development of the pathogen and of the human reaction to it, both natural and social. A spreading problem. Infections are continually transforming. Those that trigger pandemics have enough curiosity that the human safe framework doesn't rapidly remember them as perilous intruders. They power the body to make afresh out of the plastic new guard, including new antibodies and other resistant framework segments that can respond to and assault the enemy. Enormous quantities of individuals become ill temporarily, and social factors, for example, swarming and the inaccessibility of medication can drive those numbers much higher. Eventually, as a rule, antibodies created by the resistant framework to ward off the trespasser wait in enough of the influenced populace to give longer-term insusceptibility and limit individual-to-individual viral transmission. In any case, that can take quite a long while, and before it occurs, destruction rules. Figuring out how to live with a malady. The most well-known case of this dynamic in present-day history was the H1N1 flu episode of 1918–1919. Specialists and general well-being authorities had far less weapons than they do today, and the adequacy of control estimates, for example, school terminations, relied upon how early and unequivocally they were actualized. More than 2 years and 3 waves, the pandemic contaminated 500 million and slaughtered between 50 million and 100 million. It finished uniquely as regular diseases presented resistance on the individuals who recouped. The H1N1 strain got endemic, an irresistible malady that was continually with us at less serious levels, flowing for an additional 40 years as an occasional infection. It took another pandemic, H2N2 in 1957, to smother the vast majority of the 1918 strain. One influenza infection kicked out another, basically, and researchers don't generally have the foggiest idea how. Human endeavors to do the equivalent have fizzled. Nature can do it, we can't, says virologist Florian Kramer of the Icahn School of Medicine at Mount Sinai in New York City. Control. The serious intense respiratory disorder, SARS scourge of 2003 was caused not by a flu infection, however by a coronavirus, SARS-CoV, that is firmly identified with the reason for the present tribulation, SARS-CoV-2. Of the 7 known human coronaviruses, 4 circle broadly, causing up to 33% of basic colds. The one that caused the SARS flare-up was unquestionably progressively harmful. Because of forceful epidemiological strategies, for example, separating the debilitated, isolating their contacts and executing social controls, awful flare-ups were constrained to a couple of areas, for example, Hong Kong and Toronto. This control was conceivable on the grounds that disorder followed contamination rapidly and clearly. Practically all individuals with the infection had genuine manifestations, for example, fever and inconvenience relaxing. Furthermore, they transmitted the infection in the wake of becoming very ill, not previously. Most patients with SARS were not that infectious until possibly 7 days after manifestations showed up, says disease transmission expert Benjamin Cowling of the University of Hong Kong. On the off chance that they could be recognized inside that week and put into separation with great contamination control, there wouldn't be a head spread. Containment worked so well there were just 8,098 SARS cases all around and 774 passings. The world has not seen a case since 2004. Antibody Po. We hope that this epidemic will end in the shortest time and wait for any good news soon about the emergence of antivirus treatment or even any solution that helps people to complete their lives somewhat naturally until reaching a final solution such as vaccination for example, and we wish peace for all. Here we reached the end of the clip. We hope we have been able to help and impress you. We wait for permanent support and subscribe with us to receive all new. Goodbye.